Welcome to Life Care for You, your go-to channel for health insights and tips. Today, we're diving into a condition that affects millions across the globe, asthma. Whether you're living with it or simply curious, let's break down everything you need to know. What exactly is asthma? Why does it happen? And how can it be treated or managed? Stick around for the answers. What is asthma? So what exactly is asthma? Asthma is a chronic condition where your airways become inflamed and narrowed, making it difficult to breathe. Think of your airways like a network of roads. When they're smooth, traffic or air flows easily. But with asthma, these roads get congested, leading to breathing difficulties. This condition can vary from mild to severe, and it's something that requires lifelong management. Now, you might be wondering, can asthma just go away? Unfortunately, while asthma can be controlled, it's usually a long-term condition. But the good news is, you can manage it effectively with the right approach. What are the symptoms of asthma? Let's get into the symptoms. How do you know if you or someone you love might have asthma? Here's what to look out for. Wheezing. That high-pitched whistling sound when you breathe. This is one of the most common signs of asthma. Shortness of breath. Do you ever feel like you just can't get enough air in, especially after physical activity? Chest tightness. This can feel like someone is squeezing or sitting on your chest, making breathing uncomfortable. Coughing. A persistent cough, especially at night or early in the morning, can be a sign of asthma. But here's a tricky part. These symptoms might not always show up. Asthma can be unpredictable, with flare-ups happening suddenly due to certain triggers. What causes asthma? Asthma doesn't have a single cause, and often it's a combination of factors that lead to this condition. So what exactly causes asthma? Here are some key contributors. Genetics. Does asthma run in your family? If so, you may be genetically predisposed to developing it. Allergies. Many people with asthma also suffer from allergies to things like pollen, dust mites, or pet dander. In fact, these allergens are often the culprits behind asthma attacks. Environmental triggers. Pollution, cigarette smoke, and even weather changes can trigger asthma symptoms. Ever notice your breathing gets worse in cold air? That's not uncommon for asthma sufferers. Respiratory infections. A bad cold or flu can irritate the airways and worsen asthma symptoms, especially in children. How can asthma be treated? So how is asthma treated? The aim of asthma treatment is to control your symptoms and prevent attacks. Let's explore the main treatments. Inhalers, bronchodilators. These are the most common form of asthma treatment. Inhalers work by relaxing the muscles around your airways, allowing them to open up so you can breathe easier. There are two types: reliever inhalers for immediate relief during an asthma attack, and preventer inhalers to reduce inflammation and prevent symptoms from flaring up. Medications. In addition to inhalers, some people may require oral medications to keep their asthma in check. These are usually anti-inflammatory drugs that reduce swelling in the airways. Lifestyle adjustments. Managing asthma often involves making changes to your lifestyle. For example, avoiding known triggers, such as cigarette smoke or certain allergens, can reduce the frequency of flare-ups. Allergy treatments. Since allergies are a major asthma trigger, treating the underlying allergies can help. Some people may benefit from allergy shots, immunotherapy, or medications designed to control allergic reactions. Living with asthma. Tips for daily management. Managing asthma is more than just taking medication. Here are some practical tips for living with asthma. Monitor your symptoms. Keep track of your symptoms and note what triggers your asthma. This can help your doctor adjust your treatment plan. Have an asthma action plan. Work with your healthcare provider to create a personalized plan that outlines what to do during an asthma attack and how to manage daily symptoms. Stay active but safe. Don't let asthma hold you back. Physical activity is important, but choose exercises that don't trigger your symptoms. Swimming, for example, is often recommended for people with asthma. Final thoughts: asthma may be a lifelong condition, but with proper care and management, it doesn't have to control your life. Remember, this video is for educational purposes only. For proper treatment and personalized advice, consult a healthcare professional. Thank you for watching Life Care for You. Don't forget to like, share, and subscribe for more health tips and information to help you lead a healthier life. Stay informed, stay healthy.